Today's topic is tourniquets and pressure bandages. This is a call I had. It was a car versus pedestrian years ago. We came up on scene. He was riding a bike, got hit by a car. He was laying prone with under his arm. There was a massing amount of bleeding. Once we turned it over, the arm started to squirt blood and noticed a large laceration from the elbow down to the wrist that was partially avulsed. You can almost see down to the bone, but it was squirting blood. Immediately did direct pressure while my partner got tourniquets and Israeli bandages on their arm. On scene, we did get a tourniquet high and tight, which you always want to do, and we took 2 Israeli bandages or pressure bandages to cover up the wound. With that treatment right there, that did stop the bleed, and you can see by the color changes in his arm that that was definitely tight enough, and could have gone even tighter because it was seeping through a little bit. These are the products that we do use and sell and actually use on the job, is tourniquets and pressure bandages. This style right here doesn't have those clasps like these do. I find these ones a lot easier to work with than the ones with the clasp. In the ER, this is an actual x-ray of the tourniquet being used. Right here is the windlass catch, right there. The tourniquet windlass was, I believe, on this side, and here is the buckle. You can kind of see right there. But you can see how tight it was, see how much meat was being compressed. That's his actual skin, what was left of it on there, pressing against the brachial artery to stop any blood flow to the hand. And we actually tightened it down pretty good where he was screaming in pain, but it did stop the bleed. We actually had to give him some pain meds to calm him down. He was so hysterical. In the ER, they had to cut away the pressure bandages and loosen the tourniquet. This is his right arm. This is kind of his right thoracic area. This is a lady, one of the nurses sticking 2 fingers in there to control the bleeding. As you can tell, that there was bleeding still oozing out. This would be a good place to do wound packing gauze if you had time to pack the wound in there while using a tourniquet and pressure bandages. After loosening it, they did squirt some blood everywhere, so they had to examine the wound, so they retightened the tourniquet. He did go to surgery and did make a full recovery. Other than that, if you have any questions or comments, feel free to provide that. We also sell a bunch of module kits and individual stuff on our website.